Hello, everyone. Good evening. My name is Jill Board, and I am a proud alum of Georgetown University School of Nursing. I'm not going to tell you what year because I really don't want to let you know how old I am. However, I will just share that I have spent my entire professional career as a nurse at Children's National. I basically grew up there, and so I just celebrated my 30th anniversary with them. I like to tell everyone that I started as a 2-year-old child prodigy nurse a few years ago. So I'm really not that old. It's good to see some familiar faces and some familiar names in the audience with us today. I recognize some of you from nurse trainees and applicants and all that. And so it's great to see y'all. So our new graduate nurse residency program is a year-long program. It is above and beyond your orientation on whichever unit you happen to be hired into. Usually our new grads are in orientation one-on-one with a preceptor for about 3 months on our acute care units and up to 6 months in the critical care units. Our residency is an accredited program. It's a homegrown program that we have developed that is really geared to help grow our future leaders in pediatric nursing. And I think it does an excellent job in doing just that. As many of our nurse leaders in our organization were nurse residents at one point many moons ago. The residency program itself is a mixture of classroom time. There are clinical rotations. You're also expected to do a couple professional presentations. So I liken it to postgraduate pediatric nursing school. And so that's the general overview of it from that far, and I will hand it off.
Great. Any timelines that they should expect on when to apply?
So for our winter cohort, so you December grads, we usually start our winter cohort end of February, March timeframe, and usually we start to post those positions November, December timeframe. And so I'm anticipating at the end of this month, I'll probably have a better idea of what that's going to look like. But generally, we like to tell people to start stalking the website the beginning of your last semester of nursing school to see when those positions are going to be posted. For the May grads, it's usually February-ish timeframe. But right now, you know, to be perfectly honest with you, this last year has been rather interesting. And so everything has kind of been a little up in the air and all that. And so we are just starting to like look ahead toward the winter right now, and what that new grad, you know, what our hiring needs are going to be for the winter. And then, you know, beyond that, even the summer.
Great, thank you. Marta, would you go next?
All right.
For
Okay,
national, I'm
can you
sorry.
hear me? I am Marta. I am one of the nurse recruiters at Virginia Hospital Center over in Arlington, Virginia, just across the bridge, so not too far away. I myself have been a nurse at VHC for about 7 years already. I started there as a new grad nurse. I worked on mother baby for about 5 years before I went into recruitment. So I've been there for the last 2 years. Our residency program is structured very similarly to Jill's at Children's National. So it's a year-long program that all new grads are required to be participating in for their first year. And that is apart from your unit orientation. So you're hired into a specific unit and you will complete your own orientation there, upwards of about, depending on the unit that you're on, usually it's about 10 to 12 weeks, I want to say, and then it could be longer for some other areas like ICU or the OR. And So at the end of that year, once you complete your evidence-based project, it's essentially treated as your graduation. So I actually had one today from folks I recruited from about a year ago. So we follow the Vizient program. I think that's a pretty popular one amongst organizations to use for residency programs. But we've seen really great success with the program ever since we've started it, probably about 2 years now. The timelines, so just to kind of echo what Jill said about, timelines and everything with COVID and everything, it's been hard to, figure out the dates and everything, but typically with us, we tend to start recruiting very far in advance. So if you're looking to graduate, for example, next May, so May 2021, you'll want to start looking around maybe even December, but January. I know I can speak to my organization specifically. Usually in February is when we put up initial applications for that summer residency. We also hold what's called a match day. So we also had to change things up a little bit this year and turn it kind of half virtual and half on-site. So we're testing that out this week, actually. But so far, everything has gone great. And I'm feeling like we're probably going to be doing the same thing. But February is usually the timeline of when we put the applications on our website and start scheduling interviews for that August or the summer residency start. So our summer residency program is usually the biggest group of the year. Just to give you an idea, the one that we are recruiting for right now in March, we only have about 30 spots because there's not that many folks that may graduate in December. But for the summer residency, we do have about 60 spots that we allot for that group.
Perfect. Anne, can you introduce yourself and share more about your program?
Sure. It's nice to be with all of you virtually. My name's Annie Parker. I work just across that big Clark hole, construction hole from the School of Nursing and Health Studies at Medstar Georgetown University Hospital. I am a Georgetown grad 15 years ago and have been here at Georgetown for 17 years. And I'm so happy to be with you. I'm here in my office, hiding from my children who are 2 and 4 and would never let me do this discussion. They would be much more interested in talking to you about Frozen. So I am still here at the hospital. And I want to tell you a little bit about our residency programs and our summer nurse technician program. We similarly have a Vizient year-long residency program. We hire for winter starting in February with a start date in February, and for the summer with the start date in July. We're currently recruiting for our winter residency program and have already hired at least one Georgetown grad. And we begin recruitment for our summer nurse residency program in December. And we post online just for a couple of months. So our application will only be posted from December 4th through January 31st for the summer nurse residency program. We're hiring big numbers to fill that huge building that's coming up. Our 7-story surgical pavilion is opening in 2023. So the group of new grads that will start with us in February will help us move into the new building. So we are hiring a big group in the winter and an even bigger group in the summer. And I hope to see many of you. We also have a summer nurse technician program, over 50 spots for that, for those of you that graduated in 2022 and 2023. That application is posted in November, the 6th of November through the 7th of December, and we'll be doing interviews for that in January. And if you have clinical rotations at our hospital, I hope you'll stop by our office on the 1st floor of the main building. Always happy to chat with you in person or virtually about any of our opportunities. Thanks.
Thank you, Annie. So Ellen, if you could share about Northwell Health, that would be great.
Sure. Can you hear me? Is that okay? Is that so-so? Okay. Lenz, and I'm from Northwell Health. For those of you that don't know about Northwell, we are 23 hospitals in the New York area. We employ over 16,000 nurses. Of our hospitals, 7 are magnet, the rest are on the journey to magnet. I am the program director for our nursing fellowship programs, and also I oversee the nurse extern programs. We also have a residency program as well. We are very similar. We're kind of a combination of all the other hospitals. Our nurse externs are for juniors in a BSN program. It's an 8-week summer program. That application usually goes up at the end of January. Last summer, we had 95 externs in our health system. Our nursing fellowships are for critical care. They're for the emergency department, PICU, PDD, OR, and pediatric hematology, oncology, and they are quarterly. We have them in January, April, usually July or August, and October. You have to be licensed prior to starting them. They're a combination of computer web-based training, lectures, nursing and simulation, and being precepted. Those applications usually we start for the summer for the May graduates, usually in like February or March. Again, the timelines are a little bit slow this year due to COVID, so that's when we traditionally post them. Our website is Northwell Careers. You can apply, you have to apply online and upload your resume to that. We also have our nurse residency program, and our residency is a year-long program. It's a supplement to orientation, and it's pretty much similar to the other nurse residency programs in that they do an evidence-based practice. It's whatever specialty you're hired into that's not fellowship, they go into our residency program. Okay, and again, you would apply online at Northwell Careers. Okay.
Great, thank you. All right, so now we're going to get into some topics, and then we hope to have time. We will have time for question and answer. So we're going to have each panelist talk for about 5 minutes about their topic, and so definitely be thinking about your questions, and feel free to put them in the chat now, or we can discuss later, and feel free to turn your video or to give audio questions afterwards. So we're going to start with Jill from Children's National, and she's going to share some tips on resumes and cover letters.
So for resumes and cover letters, I'd like to first remind everyone that that's really your introduction to not only the nurse recruitment team, but to the hiring managers. And I tell people that that's your ticket for being invited in for an interview. So you want to make sure you're best foot forward, carefully review your cover letters and resumes for any typos, grammatical errors. It's always good to have someone else read it, not just yourself. Spell check does not catch everything. And probably one of the biggest things to do is to make sure you're sending the correct cover letter to the correct organization. I'm sure my colleagues, just like us, they're not really too happy when they get a cover letter that's addressed to another organization, sent to, with an application to their organization. And they're like, well, do you really want to be part of our organization or what? In your cover letter, that's where you get to tell your story, to share your passion, or, explain why you'd be a great hire for us. And I do encourage nursing students to truly think about why you wanted to become a nurse in the first place. And you're going to want to share that with us. And make sure you study up on the organizations that you are applying to, know what their mission, what their vision is, and reflect on how you are going to help them achieve all of that. For your resumes, we do appreciate very much for our new graduates and our nurse trainees to list the places where they are doing clinicals. So we, and it doesn't have to be a great description or anything. Simply, you did pediatrics at at Children's, and you spent 80 hours on the surgical care unit in the fall of 2019 or whatever it was. That's all we need to know. We know what kind of technologies you do on the different units, but we really like to see where you've done clinicals and how many hours of clinicals that you have had. So simply list that as clinical experience. We also like to see all your additional work experience. If you had a career prior to going to nursing school, please share that with us. We want to see you as a whole person. And certainly there are skills from other careers that you bring with you, makes you you, and we want to be able to see how you're going to translate those skills into nursing. I remember years ago, a former CNO used to always share an example of one of our nurses prior to just becoming a nurse. She actually was a florist. And you would wonder, what does being a florist have to do with being a nurse? Well, certainly, she understood customer service and being able to meet people where you're at. And oftentimes you think of people buying flowers in very happy events, but there are also times when people are buying flowers in rather sad events. And so she knew how to deal with people who were perhaps going through the grief process because maybe they were purchasing flowers for funerals. She also knew how to handle that anxious bride who is getting ready for her wedding. And so all of that customer service experience and being able to relate to people in different phases of their life, translated very well into being a nurse. I love waitresses too. So even if you haven't had a lot of opportunities to do a lot of clinical work, I love waitresses because if you can handle tired, hangry people, you're going to be a great nurse. We also love to see any extracurricular work that you've been doing, any organizations you've been a part of. At Children's National, we are really looking for nurses who have that passion for pediatric nursing, who have excellent customer service and communication skills, and really have any experience at all working with children and their families. And it doesn't have to be clinical experience. We want to see that relational piece, and so that you know how to relate to kids and their families in various settings. So, certainly if you were a coach or a nanny, or you were a daycare provider, or you worked with a church youth group, those are all types of things that you want to show on your resume. So think about where you're applying, what type of people you're looking for. Use those websites. There's a tremendous amount of information out there on all of our websites to tell you what type of organizations we are. And then figure out how your values align with that, how your work ethic aligns with that. And then you're going to want to tailor your cover letters and resumes to showcase those strengths. I hope that makes sense.
That's great. I love the florist example. So
Yeah.
I've heard different things from recruiters. So what you're saying is to list all clinicals. I've heard some say list selected clinicals. I've heard others say none. I've heard others say let's do an addendum. So I'd also love to hear from the other recruiters on just that specific question, if you all don't mind. What do you think about including clinicals on the resume? And I want to note that often recruiters will have different opinions for the students, and so it's not always black and white. I'd love to hear others' opinions. Marta?
Oh, got it. Okay. So yes, no, I love to see, where you've completed your clinicals, obviously if you completed it at my organization, I would love to see that as well. I also, one of the things that really does stick out to me as a recruiter when I'm reviewing resumes is your preceptorship, like right up at the top. It got, if you wanted to make it stick out a little bit more, even if you haven't started it, but you have that plan that you're going to be working in the ICU at, whichever hospital, I like to see that. But definitely list out all the clinicals that you've completed and where and the hours. I like to see that.
Anne, what do you think?
So I agree about the preceptorship. I think that practicum, capstone preceptorship is vital for us to know. And if you've done clinicals at Georgetown, I'd love to see that too. But for me, I just feel like it takes up so much real estate on your resume. especially if you're trying to keep it to one page. I always think make it the same page of your resume, and that way you have it prepared and they can reference it if they want to, but they don't miss the vital information about your work history or your certifications or your volunteerism or leadership. That way it's there, but it's not prohibiting them from seeing other important things about you.
Great. Ellen, any thoughts on that?
I would say that I would definitely list it, but I would definitely put more about your preceptorship. You know, I would maybe state the clinical and the location where you did it, because I think that's important, like whether it was a tertiary or a community hospital, and then your preceptorship, I would definitely elaborate.
Okay. Great. Jill, any last thoughts before or any
Yeah,
other?
I was going to say, just like to add with the clinical experiences, we do ask for that because, and Marta mentioned it too, our hiring managers do like to see if folks have done their clinicals with us. That certainly gives candidates a, it'll bring their resume to prominence in the hiring manager's eyes.
Perfect. Thank you so much. Okay, Marta, should we switch topics and you could cover job search strategies and networking?
Sure. So I just wanted to add one thing because I'm not sure if other organizations do this, but with applications to Virginia Hospital Center, there is an assessment that's associated with your applications. I've seen a lot of folks think that this doesn't really have anything, of importance to do with your application, but it does. So just if you come across any assessment with any kind of application, it's there for a reason. So usually you can go back to it if you can't complete it in that time, but make sure if you ever come across one of those assessments that you're really, you're taking the time and attention to complete that. So jumping into job search strategies and networking. So I'm going to start off by saying that, you may have already done some clinicals and you're in the middle of them. You're job searching already. And so one of the things that I like to talk about is when you're searching for jobs, it's really dependent upon, it really starts where you want to be after you graduate. So if you want to stay in the area, you've got a handful of hospitals in the area that you can start to look at. If you're looking to go to New York, you've got Ellen right there who might be able to give you some great advice and some additional information, but it's really, deciding where you're going to be after you graduate. And from there, you're going to want to research the hospitals in the area. Considering multiple things like, does this hospital have do they offer what I'm looking for? So you might be looking for something different than your friend over here sitting next to you. Other things that I hear about are like your commute, your parking, things like that. So a lot of things to take into consideration, but also important things to ask your recruiters when you're talking with them initially, just because some of that information is not always very clear, and it's always good to know all your options, all the details, and lay it out on the table when those options do come about. From there, you want to go to the careers page for that exact organization. So a lot of the organizations now, we use different engines, just to help with putting up applications out there. But and I'm not saying not to use them, but I'm basically leading you back to our organization, because essentially what happens is that you apply to through a third party source, and personally for us, it might get lost in the mix. So my recommendation would be to go straight back to the organization's career page and search specifically for nurse residency programs. Most organizations now specify if they're for new graduate RNs, and if it doesn't, pick up the phone and call the recruitment department, because you want to make sure that your application is going to the right place. You want to make sure that you get that chance to get your application in and seen by the recruiters. I am a big, I really like to use LinkedIn. I have had plenty of new grads who have reached out to me via LinkedIn, and I really like it because it shows me that they're doing their research, they're doing the networking thing. And so that kind of goes into networking now. This is a great example of a networking event. You've got several recruiters here. Jody's a great resource, and then each of you as well. I will also say, when, use your professors, your instructors, your preceptors, anybody you meet at any of your clinical sites, that is a networking opportunity for you. I have some of the most successful candidates that have made it through the doors have been candidates who have either reached out to the directors of the unit to say, I've been doing my my rotation here on the med renal floor, and I would really love to come work here. And that director calls me right up and says, I have Ellen looking for a job here. Can you talk to her and put her in touch with the process? And I love that because it just shows your drive. It shows that you're determined. That stands out. So making sure that you're talking to those preceptors, even the nurses that you're working with, during your clinical rotations, really anybody that you can pull aside and have a chat with.
Thank you. I have a question for all of you. So LinkedIn, so you must get a lot of applicants. So if somebody reaches out to you on LinkedIn, will you respond? Or is it just, hey, I see this name and I'm going to remember that later? Putting you on the spot, but I just have to ask because you have a lot of applicants.
So,
It does.
yeah.
It does for me.
Yeah.
In the last week, I've had those who have reached out have basically landed interviews this week.
Yeah. And I usually, I'll respond to everyone. And that's also a way, if I have any updates, I'll probably post something there to say, hey, we started posting new grad positions, or this is, coming now, or something like that. I do always appreciate it. And it's a smart way to connect with the organizations. I do want to echo to what Marta was saying about when you're doing your clinicals and when you're doing those preceptorships, use those connections. Perfectly honest with you, that's how I landed my job at Children's umpteen years ago.
Great. Any other additional thoughts on job search strategies and networking before we move on? Nope. Okay. All right, Annie, if you could share your tips on interviewing.
Sure. Well, so I'm echoing what others have said already, which is to really be prepared for the interview, to search on the organization's website and learn about the organization so that you can answer questions and be engaged during the process. Use your network, especially your clinical instructors and your professors and former alumni from your university who are working at these organizations to find out more about it. Those can be really helpful resources for you. I would really encourage you to prepare by answering questions. Have a colleague or a coworker or classmate ask you a bunch of questions, especially behavioral interviewing questions. If you're not familiar with that term, I would encourage you to Google it and pull up some behavioral interviewing questions so that you can be as prepared as possible for that technique. I also encourage you to be prepared to talk about your weaknesses. Especially right now, we all understand that your number of clinical rotations may have been your hours cut down. You may not have experiences that you would have had in previous years, and we completely understand that. But for instance, if you're interested in critical care and you don't have critical care exposure, I would speak about it right away and just say, I understand I haven't had as much exposure as you generally look for, but here are the reasons why I would be a great candidate anyway, and the ways that I have strengthen my application in light of that. I also think it's important to think about how nursing is really a team sport. And I think one mistake that candidates come into an interview and they make is that they really think about their own professional goals exclusively. And, when you are a nurse, it's all about the patient and it's all about the functioning of the team. So it's really important to think about when you're interviewing what you're going to do to enhance the team and to improve the patient care that's delivered, not just about your own professional goals, but about what you want to contribute and how the mission of the organization aligns with your own mission as well. The reality of the recruitment situation for us right now is that we're exclusively virtually interviewing. And so, obviously it's not ideal, but there are some really good things about it. For instance, it's much more efficient and it's much cheaper for you. You don't have to travel all over the country, just to be on the bright side. There are some good things about it. The other good thing about it is that you are probably more prepared to do this than your organization is that you're interviewing with. You are virtual everything right now and are Zooming all the time and maybe even doing it more than the person that you're interviewing with. So I think you'll be really well prepared to engage in these meetings. I think, again, it doesn't hurt to practice, especially if it's a new platform for you. It would be good for you to become more familiar with that platform, download the apps at the Teams or WebEx or something, and have a dry run to make sure that your audio and video work perfectly. Your devices, if you're using earbuds, those can sometimes be problematic. And I just think it really makes sense to minimize your distractions. If you've got a dog, if you have children, if you have a device like a phone, just to put it on silent so that you really can put your best foot forward. I also think it makes sense to part, even if we're only going to see, the top half of you. When you're dressed for an interview, you're prepared for an interview, it feels like you're interviewing. So I think it helps you to get into the headspace of doing it and being serious about it, to get dressed. I know that sounds silly, and also to think about your environment. It's not always going to be ideal, as is this mess right behind me. But I think one of the things that you can do if you're in an environment that's not ideal is to address it right off the bat. Like we had a candidate the other day that was taking an interview from her car, and she said, I wouldn't normally be doing this, but I have 3 children inside and they're all virtual learning. So this is the quietest place. And we all completely understood that and would never have, made any sort of judgment against her for that. It's really difficult because normally when you're interviewing, we're assessing your professionalism by showing up early, being prepared, looking the part, and we don't have that as much in the virtual platform. So it's good to use all the assets that you can in terms of looking professional, speaking professionally, being in a professional environment with minimal distractions. And then, looking into the camera as much as possible. If your own image is distracting for you, to turn it off, but just, again, to have practice doing it. And then, as much as possible to make it an authentic experience. I know that sounds silly, but really it's important to try to connect with a manager that you're speaking to and to be truthful and honest and as much you as you can be. And if you feel like you're having trouble getting a sense of what the culture of the unit is like, ask to speak to others. Ask to talk to the educator, the director, recent nurse residents, charge nurses. Ask for them to show you the unit and sort of take you on a tour, which we try to do as much as possible virtually. And ask if it's possible to shadow. If you're not sure, don't take the manager's word for it on the culture. Talk to as many people as you can about it, because it's a big commitment. And especially if you can't walk onto the unit before you start, you want to know as much about it as you can, and feel confident and good about it. So I hope that helps. Happy to answer any questions that you have.
That's great. Thank you, Annie. I really appreciate you talking about the virtual environment and tips for that. Let's actually move on to our last topic, so we have time for questions. And also, feel free at any point now if you all want to put in questions, or again, like when we're done with this last topic, you can also speak via audio. So whatever you're more comfortable with. So Ellen, if you could share factors to consider when launching a nursing career.
Sure. Okay, so now you all will have your resumes ready, you've applied to your positions, and you've gone on your interviews, and now you have to decide on what job to accept. You know, one thing that I really want to stress is that anybody can get a job. It's really about the right job. And your first job in nursing is so pivotal in your career. It's so important where you start your career. You know, this is something that kind of resonated with me when I started my first job in nursing. You know, it should really be a thoughtful process, much like going to college. You know, I think, you know, you really should do your research and think about the specialty that you want to start in. I mean, the great thing about nursing is there's so many choices, and that can be like a blessing or a curse at the same time. You know, you can start in one area and go to another. And, you know, I think that people think when they get an offer that, you know, they think about salary and benefits first, the benefits like tuition reimbursement, which is so important. And obviously salary is important, but in my opinion, that should be at the bottom of the list. You really want an environment that's invested in your success. You want a great orientation with great nurse educators, supportive nurse leaders, and opportunities to grow and develop, to be on committees, to really have shared governance and have a say in what happens in your practice. And the most important thing is that, as Anne mentioned, it's a team sport and you want great coworkers. So when you go to your interviews, you know, really keep your eyes open. You know, it's a little trickier now that it's virtually, but I'm sure that you've all been in clinical areas where you've been in sites where you love the atmosphere, you love the environment, you love the teamwork and the camaraderie. That's something that you kind of can't make up. You kind of see that. And, you know, really look for those things. You know, a nurse manager that is welcoming and will say, sure, go talk to my staff. That's what you should be doing. You should be walking around and seeing the unit, shadow if you can, all those things. Also, if you're taking a job in a specialty area, please spend some time there if possible. You know, many people apply for jobs or take positions that, you know, make sure that you have had some experience or at least had a shadow day or had a clinical day in a specialty if you're taking that kind of a role. You know, it's a great investment of time and resources in your orientation, and make sure it's the right fit for you. You know, I think people, again, get very hung up on what everybody else is doing. Think about what the right job is for you and what the right path is for you. You know, the wonderful thing about nursing is that you can start in one area and end up in another. And just because, you know, you might want to be in critical care, say, it's okay to start in med-surg, or you might want to be in pediatrics and you start in another area, you can get there. And that's the great thing about nursing. I really want to wish you all the best of luck in your nursing career. I hope for some of you that'll be at Northwell. If you have any questions, please feel free to ask.
Thank you so much, Ellen. I just also want to, we talked about alumni in the past, and that's a great way as well to get the inside scoop to learn about a unit or hospital. The panelists, any last thoughts that you may have on factors to consider when launching a career or interviewing? Nope. Okay, that's fine. Well, I'm going to turn off the recording now. I'm going to stop.